Greetings and welcome back to this channel. So today we are going to discuss bacterial meningitis in children. We'll look at the risk factors, the symptoms, as well as the diagnosis. And I remain your favorite Dr. Farida Rajan Ibrahim Omasundi. So do like, share and subscribe. So what is bacterial meningitis? Bacterial meningitis is an acute, potentially life-threatening inflammation of the meninges that is caused by bacterial invasion, leading to neutrophilic inflammatory response in the CSF. So what is the cause or the etiology? Mainly, we'll divide it according to the age. So from neonates to 3 months, mainly the cause is due to group B streptococcus, E. coli, Listeria monocytogenes, as well as Staph aureus. And for those that are 3 months to 3 years old, we have causes such as Streptococcus pneumoniae, Neisseria meningitidis, as well as Haemophilus influenza type B. And for those patients that are above 3 years, mainly the cause is due to Streptococcus pneumoniae, as well as Neisseria meningitidis. So what is the symptoms? What are the signs and symptoms of this condition? So we have signs and symptoms such as a vacant stare. Patients can have alternative irritability as well as drowsiness. They can be persistent vomiting with fever, refusal to suck, poor tone, crying, shock, circulatory collapse, fever or hypothermia. There can be tremors or convulsions, and also neurological deficits of varying types. Rarely these patients can also come in with bulging fontanelles. That can be associated with this condition. So during your physical examination, you also have to elicit mainly 2 signs, which is the Kenning as well as the Brudzinski sign. So for Kenning sign, you have the patient lying in supine position, and if it's present, the hip and the knees are flexed at 90 degrees, and then the leg cannot be passively extended to more than 35 degrees, or the patient flexes the opposite knee. And for Brudzinski sign, this occurs when the child is also in supine position, and then there's passive flexion of the neck, which causes the legs to bend at the hip and the knee. So how do you investigate this condition? So you can carry out your CSF studies, you can do your blood culture, ESR, CRP, you can do your full blood count and differential count. You can also do your supportive diagnostic investigations such as carrying out malaria, RDT, and MPS. You can do your HIV test, serum electrolytes, as well as the creatinine test. So remember that for meningitis, a definitive diagnosis is dependent on your examination as well as the culture of CSF. So in that note, you do a lumbar puncture. And in neonates, the procedure should be considered, especially when sepsis is suspected, because meningitis accompanies sepsis in 20 to 25% of the cases. But then there are contraindications to you carrying out a lumbar puncture, which include things such as shock or cardiovascular instability, signs of raised intracranial pressure, focal neurological signs of seizures, infection at the lumbar puncture site, evidence of coagulopathies, or an acute meningococcal disease. So how do you manage this condition? Mainly, management will be divided into your pharmacological management as well as your supportive. So for your supportive treatment, this is where you give things such as oxygen, you control your fever, pain, shock, as well as seizures. And if there is a low GCS, you can also aim to insert an NGT for feeds in this patient, and you can also put a urinary catheter for urine output as well. And how do you prevent or control your seizures? This is where you give your anticonvulsant drugs such as your diazepam or phenobarbital. And for prevention of meningocele inflammation, this is where you give your dexamethasone as well. So how or what are the complications of bacterial meningitis in children? So we can divide into local complications as well as systemic complications. And for local complications, this is where you have things such as sensory neuron, hearing loss. You can have seizures, hydrocephalus, subdural effusion or empyema. And for systemic complications, this is where you have things such as Waterhouse-Frenshingen syndrome, pericarditis, as well as meningococcemia. So this was just a brief presentation of what bacterial meningitis is, the signs and symptoms, the diagnostic strategies, the treatment, as well as the complications. See you in the next video. Thank you.